periodic ketogenic diet on newly diagnosed overweight or obese patients with type 2 diabetes. Background information and introduction. Many of us know this diet due to its popularity as a quick fat loss method. This diet, originally created for people suffering with epilepsy, is a high-fat, low-carb, and adequate protein diet. This puts the body into ketosis, which means it must burn fat for energy. Scholars in this studies hypothesized about its effectiveness for people newly diagnosed with type 2 diabetes. They believe it could have the ability to control blood glucose levels and lower body fat in overweight or obese individuals.
In this study, the researcher recruited 60 participants. All participants who were overweight and newly diagnosed as T2DM, according to the outpatient service of the endocrinology department at the hospital where the researchers worked. Their diagnosis came from within a 2-year time span between 2018 and 2020. The participants and the subjects' ages ranged from 18 to 50, and the patients' genders were not specified. The researchers split the subject pool into 2 groups, the first group being the KD group, which was the one given the ketogenic diet, and the diabetes diet control group. Both groups' diet programs lasted 12 weeks. Subjects were split into 2 groups and given different diets. The KD group's diet focused on high-fat foods and low carbs. The researchers had the subjects in the KD group eating fried eggs, salmon, broccoli, etc., and the subjects were given ranges for each nutrient intake. As you can see from the ranges, the KD group's fat intake was double their carb intake. When looking at the control group, they weren't told specific foods to eat, but they wanted their nutrient intake for carbs and fats to fall within the specific ranges. Both groups' protein intake were the same at 60 grams, and they were advised to consume at least 2,000 milliliters of water. The data shows that both groups, the KD group and the control group, having similar decreases in weight, BMI, cholesterol, etc. For the KD group, we see that there is a decrease in body mass. This group's baseline body mass started at 29.04 plus or minus 5.81, and after the intervention decreased to 26.21 plus or minus 5.74. When looking at blood lipid and blood glucose levels, the decrease rate in the KD group was significantly higher in the control group. When they looked at the blood glucose levels, they found that 9 patients in the KD group had normal blood glucose levels after the intervention. After the study was completed, the researchers asked the subjects in the KD group how willingly they are going to adhere to the diet pattern. They found that they were less likely to adhere because foods that are deficient in carbohydrates were unpleasant.
For the next slide, let's take a look at the analysis of the study. Overall, the benefits of fat as a primary energy substrate had great results on individuals who were overweight or obese. But specifically looking at the issues, less carbohydrates means no fun. Many of the individuals in the study had a very difficult time adhering to the keto diet compared to the other individuals who had more of a regular diet for individuals with diabetes. The next thing to take a look at, which is a potential issue, is the study was only 12 weeks long, so the long-term benefits and side effects are still not very clear and exactly how helpful these diets were. Next bullet point, hypoglycemic episodes during the study. That's one area for concern if the study were to happen again, just to be very careful with the drops in blood sugar or too much blood sugar during these intense diets. The next thing, during the keto diet, this causes an increase in the serum uric acid, and uric acid is a waste product found in the body, and too much of this uric acid, it's called hyperuricemia, and that can lead to gout, which is a painful type of arthritis. and more data to observe blood glucose levels and stability and the reoccurrence of hyperglycemia after the discontinuation of the keto diet. So many of the blood glucose levels showed improvement, but again, it was only 12 weeks long, so we can only see so much. Moving on to a little discussion. Which improvements could be made with this study? So obviously many of the individuals in this study had a difficult time adhering to the strict keto diet, no carbohydrates. So which incentives or techniques could be done to encourage this keto diet adherence? Another interesting thing that would be to take a look at is the additional study of the keto diet of individuals with average weight, just so you can see and compare how impactful the keto diet is overall with a person with average weight or overweight. And as mentioned before, a study that takes a look at the blood glucose levels long term after the discontinuation of the keto diet.
Some main takeaways from this study would be that there's a decrease in rates in BMI, waist size, cholesterol, weight, triglycerides, and fasting glucose for both groups. It is important to know that the decreased rates in the ketogenic diet group were way more significant in areas such as body mass, blood lipid, and blood glucose levels. Some statistics that help support this claim would be the amount of patients that ended up with regular glucose levels after the intervention. 9 people from the ketogenic diet group ended up with regular blood glucose levels, while only 1 person from the control group ended up with regular blood glucose levels after the study. Before moving forward, it is important to know what hypoglycemia is. Hypoglycemia is when your blood sugar levels are extremely low, with some of the symptoms being fatigue, sleepiness, and nausea. That being said, during the first 4 weeks of the intervention, 10 people from the ketogenic diet group experienced hypoglycemia symptoms, while only 2 people from the control group experienced these symptoms. This just shows how daunting the ketogenic diet program was for the people who had to experience it. With this in mind, it is no surprise that the willingness to adhere to the ketogenic diet for such a long period of time was very low. The extreme requirements of the diet ended up causing 6 people from the ketogenic diet group to withdraw from the study, making it a total of 24 people being observed in this group. There was 1 other person who withdrew from the control group as well, making it 29 people observed for the group. Real-world application. This intervention helps showcase that the ketogenic diet can help diabetic patients regulate blood glucose levels. Due to the fact that glucose is distributed much slower throughout the body, this diet program can also help rapidly improve glucose control and alleviate insulin resistance. These results also suggest that it can be used for patients diagnosed with obesity, as it has shown to decrease body mass and waist circumference. Some of the side effects of this diet, however, would be that it causes low energy and can simulate a state of starvation due to the low supply of carbohydrates. The ketogenic diet also has extremely strict and limited food choices, and if it were applied, it should only be upheld for short durations of time, which is no more than 12 weeks, as people have shown desires to stray away from the program even in earlier stages.
On the next two slides, you'll be seeing the references used during the study and all the information that they gained from different sources throughout the experiment.